Well, let's talk. You see basically everything pretty clear in front of you, but you don't see, whatever, 10, 20 feet away, or slightly far away. It's all fuzzy or whatever. What are we talking here? What illness and what choices do we have to fix it?
That we're talking about myopia or nearsighted. One thing I like to say, you refer to it as an illness. I don't like to call it an illness because it's not. It's pretty much the shape of the eye. Just like the shape of your nose, your lips, your ears, it's the shape of the eye that it's a little bit different than average, and it causes vision distortion. That was just a side. When a person is nearsighted, the length of the eye of the entire globe is a little bit longer than the average. Therefore, that image now, instead of focusing on the retina again, it focuses in the back of the retina. So we need lenses to refocus that image to bring it forward a little bit. And again, in this case, is also glasses, contact lenses, they work pretty much the same. Some people, if you have a very high prescription, if you're very nearsighted, contact lenses might work a little bit better because as I was saying before, when we use glasses, what glasses do is they change the image size that we ultimately receive. When a person has a very high prescription, the image size is altered much more, making everything a little bit much smaller, so harder for the brain to ultimately detect and individualize. So contact lenses work a little bit better because the image size it's not affected, and also you might have seen, some people have very thick lenses, very thick glasses. When that happens, your peripheral vision is also affected. Because now you have to look through that thick portion of the lens. So in that case, again, contact lenses are going to work a little bit better because your peripheral vision is intact, it's not distorted. But both will work just as well. That's more also a preference, whatever preference the patient has.
Right.
One other thing that also affects vision, it's what we call astigmatism. Okay, astigmatism, it's also based on the shape of the eye. The cornea, which is the front part of the eye, instead of being perfectly round, it's more oval shaped. So one side is a little bit longer than the other, looks more like a football instead of a basketball, and that also causes vision distortion. That can affect vision at both distance, far away, or up close. It really doesn't matter. And the biggest complaint of people that do have astigmatism and it's not corrected is blurry vision when they drive at night. That's the number one complaint of patients that have uncorrected astigmatism. When I drive at night, it's uncomfortable. I get a lot of glare, and I don't feel comfortable driving at night.
So how is it corrected?
Same thing, glasses or contact lenses. Now, a person that has astigmatism can also at the same time be nearsighted or farsighted. It really doesn't matter, has no correlation between the two. Okay, so you could be nearsighted and have astigmatism.
I see. Okay. So you can be nearsighted, have astigmatism, then you have blurry vision, especially at night. You can be farsighted. You can fix it and still have blurry vision at night because you didn't fix the astigmatism.
Correct. So when we correct, if you are nearsighted with astigmatism or farsighted with astigmatism, we have to correct both. Just correcting one, it's not going to work. The vision is still going to be blurry.
Is there an English word for astigmatism?
Astigmatism.
Okay. Can you again, you probably said it, but can you again, reformat a definition, in terms of conceptually explaining it?
Yeah, if you're asking me if there a word like nearsighted or farsighted, no, it's just this one word, astigmatism. Okay. Unfortunately, a lot of people call it stigma, which makes it sound really, really bad. I have a lot of my patients come in and they say, I have stigma. That sounds really bad. Astigmatism is just the shape of the eye. As I said, if we want to summarize in a nutshell, the front of the eye is more oval shape, looks more like a football versus a basketball. But there is no lay term to describe astigmatism, unfortunately.
Well, that's what it is. Astigmatism, your eye is not shaped the way it should be, and that has a tendency, one of the biggest tendencies is night vision becomes bad.
That's one of the biggest complaints, yes.
All right. And it can be fixed in combination with any other farsightedness, nearsightedness, needing reading glasses type of thing. It can be fixed with any of it together.
With everything, correct.
Okay, good. And it's there as it is. It's not like glaucoma or like macular degeneration, which kind of keeps growing. It is what it is, and that's it. Is that how it goes?
Is what it is. Just like, as I said, just like the shape of your nose, your lips, your ears. I mean, it does change. If you're a young patient, there is a chance that until the age of, early 20s, where everything else starts to settle, that the prescription, this astigmatism can continue to progress. But after that, it just stays stable. We don't have major changes in astigmatism, but not just astigmatism. This with all the other kinds that we described, whether it's nearsighted or farsighted. Once we reach once our growth pretty much has finished, so in the early 20s, most likely prescription remain the same unless something else happens to cause vision problem, like a medical problem like diabetes or severe high blood pressure. But most likely it's going to stay the same.
Got it.
Yeah.
All right. Can it also be fixed with surgery?
It can be fixed with LASIK surgery. Astigmatism, because of the shape of the eye, becomes a little bit more complicated to correct with LASIK surgery. As long as it's not a tremendous amount of astigmatism, it can be fixed. If it's too high of an astigmatism, then it cannot be fixed with LASIK surgery.
Then again, the glasses and the thing.
Glasses or contact lenses
are the way to go. Well, thank you very much.
Yeah.